we had the opportunity to go to Dr. Assil's office and have continuing education with Dr. Assil, Jessica, and Dr. Gaur, and it was fabulous. One of the things that they actually kind of changed up, I mean, it was a participation CE, but they were talking about holistic healthcare management, which isn't discussed enough at all. Your patients come in and ask you tons of questions about holistic options, and as a doctor, you have very limited information about that, or at least discussed clinically in Western medicine. So then you're kind of, do I make this recommendation? Do I not make this recommendation? How do I handle this? So they addressed some of that with Dr. Gaur's talk, and then they kind of went into how to take care of yourself first as well. So, as a doctor, how do you care for yourself and then provide care for others, and what does that look like? And one of the things that they had us doing is they had us doing journaling. And I love journaling. I journal every day. But the amount of the way that you talk to yourself, the way that you express different energies that you're moving through, the way that you're interpreting what's going on in your day-to-day, if you've had a really hard day and you write that down, you get to let go of that, you get to move through that. And one of the things with the journaling that we were doing was talking about a hero's journey. So the idea that not everything is always going to be smooth sailing. You're going to have ups and downs. And the more that you recognize the pattern and the cyclical nature of those things in your life, the less of a struggle it becomes and more of an opportunity. And I've definitely seen that in my own life. You have these moments that are just intensely difficult, and you're trying to struggle and process it. And what does it mean? What is it for? How can I, get past this? How can I continue to help myself or help someone else, or, show up to work for my business partner, or whatever it may be. And the answer is that there's a next phase. There's always a next phase, and trusting in that, and, kind of doing that work independently. And they gave you an outline for it in that continuing education, and it was amazing. It was really nice to hear someone else talking about that.
Absolutely. I mean, I liked it because so much of it wasn't rooted in just optometry or ophthalmology or disease, but it still had to do with health, with mental, emotional, spiritual health, which is not, I don't think I've ever had a class on it throughout graduate school or even undergraduate. And it's like a separation, like this is what you go to school to learn, but you still have to function as a human being. And it was a unique experience to be able to move through different spaces. I mean, the timing was really interesting because it was the LA Marathon and it was Persian New Year, and it was just like there was so much just newness and opportunity that was just coming forward. So the timing was actually really, really interesting and fortuitous. But then a lot of it too was like mind shift, and it's like you said, opportunity instead of like you have to do something, you get to do something. The cyclical nature of so much of what we do on a daily basis, seasonal, yearly, life basis, to recognize where we are individually in that process and recognize that, yes, we are going through struggle, but that's a part of moving through a phase or moving through a challenge or an obstacle, because it's to set you up for success later on, and or pass along that knowledge, that wisdom, that experience to someone else who is struggling somewhere down the road. Because I mean, that's the whole reason that we do this, to make someone else's journey a little bit less strenuous, easier, lighter. And it was really cool to watch Kerry work and lead and just take us on this kind of a little magical, whimsical kind of journey on a Sunday morning. It was much needed. So I was really happy with it.
To hear other providers who have similar things going on, they have similar struggles to you, and you aren't so isolated in your practice, in your bubble. We are practice owners, we are doctors, we are these people, but all of us have these struggles. We all start a business venture and think we're kind of crazy, or we all, have had losses or what that looks like. And there's something that is very powerful just in sharing that, in acknowledging it and not saying, oh, this is a professional space. We don't talk about that in a professional space. to be able to be open and honest with one another, I think it does make the whole community, the whole medical community, that whole referral network, that, you know, your peers, it makes you a lot closer.